Hello guys, welcome back to my YouTube channel. From this video, I'm going to discuss about ninth cranial nerve, glossopharyngeal nerve. So you will learn about the nuclei of origin, the functional components and the cause of this glossopharyngeal nerve. Then what happens if there is a lesion of glossopharyngeal nerve and what are the relations in jugular foramen with this glossopharyngeal nerve. Those are the subtopics that I am going to cover from this video. You already know glossopharyngeal nerve is the ninth cranial nerve. It is developmentally the nerve of the third pharyngeal arch. Actually, this glossopharyngeal nerve is a mixed nerve with larger sensory component and smaller motor component. The nerves bear two sensory ganglia, which is superior and inferior. There are four types of nuclei of origin. They are nucleus of ambiguous, then solitary nucleus, spinal trigeminal nucleus, and inferior salivary nucleus. Those are the four types of nuclei of origin. Now we will talk about the functional components of glossopharyngeal nerve. So first there are special visceral efferent fibers which arise in nucleus ambiguous for supplying of stylopharyngeus muscle. Here is the nucleus of ambiguous, so this supplies stylopharyngeus muscle. Then you have general visceral efferent fibers which arise in inferior salivary nucleus, and these preganglionic fibers synapse in otic ganglion, from where postganglionic fibers supplies the parotid gland. Then you have special visceral afferent fibers, these fibers which terminate on the nucleus of tractus solitarius. Here, the peripheral processes bring taste sensations from posterior one-third of the tongue, including circumvallate papillae, and these are the central processes of inferior ganglion. Then you have general visceral afferent fibers. These fibers which are the central processes of inferior ganglion and terminate on nucleus of tractus solitarius. It is also terminate on nucleus of tractus solitarius, and the peripheral processes of this ganglion bring sensations from carotid body and carotid sinus. Then you have general somatic afferent fibers. These fibers bring pain and temperature sensations from posterior one-third of the tongue, tonsils, auditory tube, and middle ear to the sensory nucleus of trigeminal nerve here. So those are the functional components. There are 5 types of functional components related to this glossopharyngeal nerve. Hope you are understood well. Then the glossopharyngeal nerve leaves the medulla oblongata as 5 to 6 rootlets at the posterolateral sulcus. Here, posterolateral sulcus between olive and inferior cerebellar peduncle. These two are the pyramids in the medulla oblongata, and this is the olive, and posterior to this there is inferior cerebellar peduncles. So, the glossopharyngeal nerve emerges between olive and inferior cerebellar peduncle. Then this glossopharyngeal nerve emerged to this posterior cranial fossa, and after emerging to posterior cranial fossa, the rootlets unite to form a nerve trunk. Here is the nerve trunk, the glossopharyngeal nerve here. This is the ninth cranial nerve or the glossopharyngeal nerve. So then the nerve passes laterally and anteriorly on its way to jugular foramen. This is the jugular foramen, and then it grooves the jugular tubercle of the occipital bone and then turns abruptly down to enter into the jugular foramen. Then it passes through the central part of the jugular foramen, lying in front of the vagus and accessory nerves, but in a separate dural sheath. This is the vagus nerve, and this is the cranial root and spinal root of the accessory nerve. But this glossopharyngeal nerve goes in a separate um, dural sheath. Actually, this jugular foramen is divided into three parts. The anterior part gives passage to inferior petrosal sinus. Here is the inferior petrosal sinus. The central part contains 9th, 10th, and 11th cranial nerves in that order from anterior to posterior. This side is the anterior and this side is the posterior. So, anterior to posterior, glossopharyngeal nerve, vagus nerve, and spinal accessory nerve. The posterior part contains the beginning of the internal jugular vein. Here is the internal jugular vein. So, the posterior part contains the beginning of the internal jugular vein. The superior and inferior sensory ganglia of glossopharyngeal nerve, these are the superior, this is the superior ganglion and this is the inferior ganglion. So, those ganglia of the glossopharyngeal nerve lies on its trunk in the jugular foramen. The inferior ganglion is concerned with taste sensation. Inferior ganglion is concerned with taste sensation from palate papillae. Then the superior ganglion is concerned with general sensations from the areas of supply of the nerve. Um, Here it exit from this internal jugular foramen. Then below the jugular foramen, the glossopharyngeal nerve courses downwards and forward between internal carotid artery and internal jugular vein. Remember, it courses downward and forward between internal carotid artery and internal jugular vein, and then between external carotid artery and internal carotid artery. Then it turns anteriorly and winds around the lateral aspect of the stylopharyngeus muscle. This is the stylopharyngeus muscle. This is the styloid process. And this is the stylohyoid ligament. Green color one is the stylohyoid ligament. This is the hyoid bone, middle constrictor muscle of the posterior pharyngeal wall. Then this glossopharyngeal nerve turns anteriorly and winds around the lateral aspect of the stylopharyngeus muscle to reach the anterior aspect. On their way to pharyngeal wall, the nerve and muscle are related to superior constrictor at tonsillar fossa. They enter the pharynx in gap between superior and middle constrictor. Here you can see only the middle constrictor muscle. In this area you have the superior constrictor muscle. So this glossopharyngeal nerve goes towards the pharynx in between superior constrictor muscle and middle constrictor muscle, and it gives several branches. Tympanic nerve is the first branch. This is the tympanic branch, and it also called as Jacobson nerve, and it leaves the inferior ganglion and enters a small foramen in the jugular fossa leading to tympanic canaliculus. Through this canal, tympanic branch reaches the middle ear where it forms a tympanic plexus on the surface of the promontory. Here is the tympanic plexus on the surface of the promontory. The tympanic plexus supplies sensory branches to middle ear, lateral part of auditory tube as well as mastoid antrum and air cells. The lesser petrosal nerve arises from the plexus. You can see this is the lesser superficial petrosal nerve. It arises from this tympanic plexus. And then it carries preganglionic parasympathetic fibers. Then first it enters into the middle cranial fossa and then the infratemporal fossa to end up in the otic ganglion. This is the otic ganglion. Then the postganglionic fibers which arising from this otic ganglion supplies to this parotid gland. Lesser petrosal nerve carries preganglionic parasympathetic fibers. Then there is a second branch called carotid sinus nerve. It arises just below the inferior ganglion for the supply to carotid body and carotid sinus. The carotid body contains chemoreceptors in here, the carotid body, It contains chemoreceptors that monitor the carbon dioxide and oxygen concentrations in the blood, and carotid sinus contain baroreceptors that monitor the arterial blood pressure. Then there are pharyngeal branches. Here is the pharyngeal branch. This branch arises in the pharyngeal wall, and these filaments form pharyngeal plexus in the buccopharyngeal fascia covering the middle constrictor muscle by uniting with the pharyngeal branch of the vagus and pharyngeal branch of sympathetic. The glossopharyngeal nerve supplies pharyngeal mucosa via this plexus. Then there is muscular branch here. The muscular branch to supply stylopharyngeus muscle. Then there are tonsillar branches here, and those tonsillar branches supply the tonsils and soft palate. Then you have the finally the lingual branches which supplies the circumvallate papillae and mucosa of the posterior one-third of the tongue. So that is all about the pathway on the nuclei of origin of the glossopharyngeal nerve. So let's discuss about what happens if there is a lesion, and somewhat about the gag reflex and what is glossopharyngeal neuralgia. The gag reflex is elicited by applying stimulus to the posterior pharyngeal wall or soft palate. This results in elevation of pharynx and elevation of soft palate and retraction of the tongue. The afferent limb of this reflex is the glossopharyngeal nerve, and the efferent limb in the vagus nerve. The gag reflex is lost in lesion of either of the nerves, the glossopharyngeal or the vagus nerve. This is how the pharyngeal gag reflex is done. This is the pathway of gag reflex. The afferent limb is the glossopharyngeal nerve and the efferent limb is the vagus nerve. Then there is a condition called glossopharyngeal neuralgia. Actually, this is characterized by intractable episodic pain precipitated by swallowing and felt in throat, behind the angle of jaw and in the ear. Surgical sectioning of glossopharyngeal nerve or nerve block relieves these symptoms. In this area, there is severe intractable episodic pain due to this glossopharyngeal nerve. If you are doing a surgery, the nerve block, the nerve is approached through the tonsillar fossa for the purpose. Sometimes there can be isolated glossopharyngeal nerve injury may occur during tonsillectomy. This results in ipsilateral loss of gag reflex, ipsilateral loss of taste from the palate papillae, and ipsilateral loss of general sensations in pharynx and soft palate as well as posterior third of the tongue. Remember, if there is an isolated nerve injury, glossopharyngeal nerve injury, there is a loss of gag reflex, ipsilateral taste sensations, general sensations, all are lost in the ipsilateral side, not the contralateral side. Remember that as well. So that's all about the clinical aspects related to this glossopharyngeal nerve. So I hope you understood well about this glossopharyngeal nerve, and subscribe into my channel for more videos, and thank you for watching.